My name's Asheesh Sharma, or Ash Sharma, and I'm a consultant nephrologist here in Liverpool. When I was a medical student, I was lucky enough to do a short attachment on the kidney unit with an inspirational team of doctors and nurses, and that captivated captured my interest and captivated me. In particular, I remember a patient who'd been really unwell with a rash, and they were the only team, it seemed, that were able to get to the bottom of what was going on. I went on to do some training as a junior doctor on the kidney unit here in Liverpool, and that was me, hook, line and sinker. That was back in the year 2000, and then I trained as a registrar here between 2003 and 2011 before becoming a consultant. I've been a consultant here for coming up to 14 years now, and that's partly, the role involves partly delivering the service where you have the pleasure of actually providing care. That might be to inpatients on the ward, seeing dialysis patients on the unit and in clinic most commonly, but it also involves trying to lead and shape the service and helping to work together within a much broader team of all sorts of different health professionals that help us to deliver what we try and do, which is holistic care for our patients. When the kidneys aren't performing their function to clean the blood as well as they should to keep a patient well or alive, there are a range of options for how we might replace the function of the kidneys, if you like. But people commonly understand and know about coming into the hospital or a hospital setting to do dialysis 3 times a week, usually for several hours. But what we recognise and want to be able to offer to a greater number of patients is the opportunity to perform that dialysis at home. And that can be either peritoneal dialysis or dialysis via a little tube that sits in the tummy, or dialysis intermittently on several days of the week using a hemodialysis machine. And for many patients, once they have the confidence to recognise that this is an option for them, it can give them a greater degree of freedom to manage their time. It gives them, or it empowers them to be able to be in charge of their health to a greater or lesser extent, and to work in partnership with us on a much more equal playing field, if you like. It may mean that they are less restricted in terms of their diet and fluid for some patients, and there may even be an advantage in terms of survival for some, but certainly for quality of life, we hope. The Kidney Information Network is a platform that enables patients to connect with health professionals and with one another, and to support each other, not only with information but with their own experiences and how they've navigated them. And I think that having a chronic disease can be quite an isolating experience, particularly through COVID. And a platform like this, for those that are willing and able to engage with it, it can be transformative in terms of that opportunity to engage and support and gain support and to support others. It must have been nearly 10 years ago when I came to learn of the work that Paula, Christina and Rob had started in Greater Manchester, and it was really exciting to hear how they were using technology to transform the way in which patients could be connected with and supported and support each other. And we were approached by them several years after they'd piloted their work in Greater Manchester and really got it up and running successfully, to ask whether we were able to help spread that and scale it in Cheshire and Merseyside. And that was a really exciting turning point for us here. The way in which we can communicate with and support patients is modified, usually favourably, or almost always favourably, when they have had the opportunity to gain information and can approach the consultation as partners and as equals. And the Kidney Information Network is a really important part of the menu of options now available to our patients to enable them to be empowered, supported with knowledge, and to come to us so that we can work in partnership. I think anything that can offer another pillar of support, high quality information, access to information, sharing of experience, and that knowledge that you're not alone can only improve the outcomes and experiences of our patients, which are otherwise, tough.